prevent the backflow of blood, to make sure blood only flows in one direction, in this case, into these great vessels. Okay? Now, these valves should be closed when the AV valves are open. Okay? And here we go. We have them in position right here. These are the two semilunar valves. This one is at the entrance to the pulmonary trunk, coming from the right ventricle. And from the left ventricle, this valve is at the entrance to the aorta. When the AV valves are open and blood is filling the aorta, the ventricles, the semilunar valves should be closed. Okay? And then, of course, when the heart contracts and the AV valve snaps shut, making our first heart sound, these valves will open as blood is forced up into these great vessels. Okay? Now, these particular valves do not have chordae tendineae or papillary muscles. All they are connective tissue flaps that are actually extend out of the wall of the great vessel. And when they are closed, here we can see the ventricle is contracting and forcing blood up into the vessel through the valve. So the valve is open here. And then when the heart relaxes, the valve snaps shut and prevents blood from flowing backwards into that ventricle. Okay, that's what we see here. When these valves snap shut, we get our second heart sound. This is the dub sound, it's the love dub. So semilunar valves closing, second heart sound. Okay? And it's important to remember what is happening to the heart at this point. When the heart is contracting and blood is being forced into the great vessels, the semilunar valves are open, the AV valves will snap shut, and that's our first heart sound. Once all the blood has been forced out of the ventricles relax to refill with blood, our AV valves will be open, and the semilunar valves will snap shut, and that's our second heart sound. Okay? And we'll have a look at the whole cardiac cycle and how they all fit together. Okay? This is just a superior view of the heart. We've removed all the great vessels so that you can see actually the four valves that are in the heart. We have our two atrioventricular valves, these large ones right here, between the atria and the ventricle. And these are the semilunar valves, the one at the entrance to the pulmonary trunk, and then right here at the center, the one at the entrance to the aorta. And here's our coronary arteries, our right and left coronary arteries coming off the heart. Alright. This is an actual image of an AV valve, okay? Remember, atrioventricular valve had valve cusps of connective tissue, and then chordae tendineae, also, these are tendons, so they are also dense, regular connective tissue, and they go all the way down to papillary muscle, which is an extension of the muscle wall, all right? And this muscle wall, of course, is cardiac muscle tissue. Remember your AMP1 tissues, right? Now, if we look at the edges of the valve cups, okay, you see how that they're kind of bumpy? They're kind of lumpy and bumpy right there. This is important because if somebody has an infection of the blood, whatever source of that infection, anytime the blood flows through this valve, it can drop off bacteria. Bacteria love to get into these little nooks and crannies right here. And if somebody especially has high blood glucose, that bacteria will start to form a colony, and it will create an infection of this valve cusp. And that infection will actually lead to a failure of the valve, inflammation and failure of the valve. I just want to mention that. We'll talk about it again later. Here is a semilunar valve. I know some of you actually saw this with the heart dissection, but if you remember, we just had these little flaps of connective tissue off the wall of the vessel has been opened up, and what we have are these little flaps of connective tissue here. There's three of them, and these flaps of connective tissue would actually push together and seal off the entrance to the vessel when the heart is relaxed. Okay? All right. Now, when there is a problem with the valve, it often creates an unusual sound we call a heart murmur. Okay? The heart murmur can be caused because the valve is stiff, or it's because the valve is overstretched. There's different reasons for heart murmurs. And they, it can. Some heart murmurs are physiologic. For example, a pregnant woman, when she becomes pregnant, towards the end of her pregnancy, 6th, 7th, 8th month, her blood supply actually increases by 1/3. This large extra amount of volume of blood actually causes heart murmur. And this is a normal heart murmur. It's called a physiologic murmur. So it's normal. And after she gives birth, it will go away. So it's not a problem. But if there is damage to the valve, then yes, that will stay with you for the rest of your life. Your body has difficulty healing damaged connective tissue. Remember, when connective tissue gets damaged, instead of regenerating, it tends to scar. All right, that's the difference. If you cut your skin, the epidermis, which is a stratified squamous epithelium, will regenerate. But if you cut down into the dermis, the layer below that, that's connective tissue. That's dense, irregular connective tissue, and instead of regenerating, it will scar, form a scar. And that's what happens to the connective tissue of the valve. They'll scar, and so you end up having a murmur for the rest of your life, unless you have it somehow fixed by a valve replacement. Sorry? It can be if it causes stress in the heart and it either decreases the volume of blood being ejected from the heart, or it prevents blood from being ejected from the heart. Then it's a problem, and it'll result in symptoms like shortness of breath and even cyanosis, decreased oxygen to the tissues and the blue tint of the skin. So yeah, it can become a problem, and then it has to be treated. Valve replacement therapy is usually what's done for very severely damaged or diseased valves. There are some medications that can help, but only temporarily, because eventually the valve will give out. So here are some of the terms that we can see describing problems that occur with valves. Stenosis. This word refers to a stiffening of the valve. When a valve becomes stenotic, not only does it become stiff, the valve cups become stiff, but also very often they get stuck in position and it narrows the opening of the blood vessel. So in a stenotic valve, very often you have a restricted or narrowed opening narrowed opening to the actual valve in the vessel. So what happens is a stenotic valve, very common cause of stenosis, occurs with the aorta. Remember, the aortic valve is a semilunar valve. Something that happens with age, old age, is calcification, deposits of calcium minerals on the edges of the valve. This is common in elderly people and very often will result in a slight clicking murmur because of aortic stenosis. Very commonly seen in older people. Doesn't necessarily cause symptoms. A lot of people can live with it for the rest of their lives and never be harmed, but it's commonly heard. Another problem you can see with the valve is pretty much the opposite. It's that when valves become overstretched, they can become prolapse. Prolapse is when the valve doesn't close properly, it actually inverts, like opening an umbrella and then having the umbrella go inside out, like that, which might happen next week to all of us with our Frankenstorm. But a prolapse valve very often occurs because the valve becomes overstretched. And when it's overstretched, it doesn't close properly and blood can leak through. Okay? So again, in both cases, we have a problem with the valve. And in both cases, you will hear a murmur. Now, this word down here, regurgitation. Regurgitation describes the blood leaking through an incompetent valve. And regurgitation very often occurs in prolapsed valves, but you can also see it in stenotic valves as well. All it means is that blood is not being prevented from going back where it came from. So the valve, when it closes, is not supposed to let any blood through. But if the valve is stenotic or prolapsed, it may let blood through, and that is called regurgitation. Sometimes you can actually hear blood regurgitation, and that also causes a murmur. Okay.